Did you know one of the most prescribed medications worldwide comes from treating an underactive thyroid? Let's talk about it. Hello, I'm David from the Pharmacy Corner. I'm here to break down health topics in a clear, simple way with key facts and practical tips. Let's get started.
Levothyroxine is a medication used to replace or supplement thyroid hormone in your body. Levothyroxine is a synthetic form of the thyroid hormone thyroxine, which is naturally produced by your thyroid gland. It helps restore normal energy, metabolism, and body functions that depend on thyroid hormone. If you have an underactive thyroid, also called hypothyroidism, your thyroid gland doesn't produce enough of this vital hormone. That can make you feel tired, gain weight, feel cold, or even affect your memory and mood. Levothyroxine helps restore your hormone balance so your body can function normally again. According to the U.S. Food and Drug Administration, levothyroxine is considered the standard treatment for hypothyroidism. It works the same way as the natural hormone your thyroid would normally make. Your thyroid hormone affects nearly every organ system, from your heart and brain to your muscles and skin. Without enough of it, your metabolism slows down, which can affect energy, body temperature, and even heart function. The National Institutes of Health's Medline Plus notes that correcting low thyroid hormone with levothyroxine can improve energy, restore normal growth in children, and reduce risks linked to long-term untreated hypothyroidism. Some people may also take levothyroxine after thyroid surgery, radioactive iodine treatment, or for certain thyroid cancers when doctors want to suppress hormone-stimulating signals. Levothyroxine is usually taken as a once-daily tablet, and your healthcare provider carefully adjusts the dose based on your body's needs. Because thyroid levels can change over time, you may need regular blood tests to ensure your hormone levels stay in the right range. The dosage of levothyroxine is highly individualized based on factors such as age, weight, severity of hypothyroidism, and other health conditions. You should never adjust your dose without consulting your healthcare provider. Like any medication, levothyroxine can have side effects, especially if your dose is too high. Common ones include feeling nervous or irritable, trouble sleeping, sweating more than usual, or having a fast heartbeat. These symptoms are often signs of getting too much thyroid hormone. On the other hand, if your dose is too low, you may still feel tired or sluggish. That's why staying in touch with your healthcare provider is so important. Before taking levothyroxine, tell your doctor about your full medical history. It may need extra care in people with heart disease, osteoporosis, or adrenal gland problems. Certain foods and supplements can interfere with how your body absorbs the medication. For example, calcium and iron products may reduce how well it works if taken too close together. The National Library of Medicine's PubMed Central highlights the importance of consistency, taking levothyroxine the same way every day to keep your hormone levels steady. You usually take levothyroxine once daily on an empty stomach, with a full glass of water, and wait at least 30 to 60 minutes before eating or taking other medications or supplements. To sum it up, levothyroxine replaces the thyroid hormone your body may be missing. It's highly effective when taken correctly and monitored. Common side effects are usually linked to getting too much or too little. Always share your full medication list with your healthcare provider to avoid interactions. This video is for educational purposes only, not medical advice or diagnosis. Always consult your healthcare provider before making health decisions.
Thanks for watching the Pharmacy Corner. David here. If this helped you understand your health, please subscribe for more clear tips. What health topic would you like next? Stay well.